everyone, and welcome to our November 13th, 24 regular meeting of Council. The City of Belleville acknowledges we are meeting today on the traditional territory. We recognize and honor the historic relationship of the Indigenous peoples to this land and acknowledge our shared obligation to respect, honor, and sustain these lands and the natural resources contained within. We recognize all First Nation, Métis, and Inuit who call Belleville their home and support the need for cultivating a strong relationship with them. We look forward to fostering a path towards reconciliation and show respect for the Indigenous peoples who first lived and currently live on the land where we all now reside together. I call this meeting to order, noticing that Councillor Chatton is not here. Please remain standing for a moment of reflection from Deputy Clerk Katie McPherson.
May we be worthy custodians of all that has been entrusted to us. Help us to be concerned only with what will promote good government. May we bring to council chambers minds that think and hearts that feel, always having respect for others so that we may serve the people of our city in a helpful manner and for the good of all.
Please be seated. Disclosure, pecuniary interest and general nature thereof. Seeing none. I need a motion for reading and confirmation of the minutes of regular council meeting minutes of October 28th, 24, regular in-camera meeting minutes of October 15th, 24, and October 28th, 24. Moved by Councillor Kelly, seconded by Councillor Enright Miller. Discussion, all in favor, carried. Deputations. First we have Dr. Rob Pincock and Karen Clayton-Babb, who are here to make a deputation on behalf of the Hastings Prince Edward Ontario Health Team. Good afternoon. The floor is yours.
Good afternoon. Thank you very much for having us. I'm Dr. Rob Pincock.
And I'm nurse practitioner Karen Clayton-Babb.
I was here several months ago to discuss the work of the Hastings Prince Edward Ontario Health Team, and we're back now with some updates regarding that work, and we're happy to have the opportunity to share that with you. So the OHT in Hastings and Prince Edward has been working for the last 2 years on strategies to connect residents and people who seek care in our region with primary health care. And our aim is that all the residents in Hastings and Prince Edward counties have access to primary care within this region. Our collective progress has been ongoing, and we are expecting a proposal or an RFP from the province in the near future. And we're happy to share our ideas with you today about that. So I've shared previously some statistics about the region, but to focus specifically on Belleville, we do have health challenges in Belleville. We have, compared to the rest of Hastings and Prince Edward, a higher concentration of racialized population. We are the default community for newcomers to the region, and we're home to a population that faces material shortages and has difficulty accessing materials to meet their basic needs. We also have challenges in terms of the health status of our community, with significant utilization of the emergency department for addictions and mental health, with 32.5 visits per 1,000, which is double the provincial rate, more or less. We also have a significant burden of lung health issues with 81.3 hospitalizations per 10,000 for COPD. If you look at the provincial rate, that's 29.3 per 10,000. And then we note that 32% of all low acuity emergency department visits were for patients without access to primary care. If you look look at our unattached population, what's actually interesting is that the majority of them are actually not the frail elderly. They're majority under 50 years of age. They have lower rates of screening, and they have a significant, the prevalence of chronic disease among this population is actually lower. So what we're talking about is, a population that's actually somewhat healthier than the rest of the population, but should they need to access healthcare episodically, they don't have that access. So our progress thus far started in 2023, and I'll let Karen tell you about that.
Thank you, Ron. Good afternoon, everyone, and thank you for having us. So our program started in April to December of 2023, and this was when we started the engagement sessions with stakeholders to collect information about the population in the region. From January to August 2024, we also had additional engagement sessions which involved all the stakeholders, not only healthcare stakeholders, but social services, education, very diverse group. And that session, we also gathered information around the health of the region. And this information is what we're using to develop the primary healthcare strategy for our region. We have since commenced a writing team to develop the proposed model. From September until this point, we've also tested some of the initiatives that were born out of these engagement sessions around the data that we gathered. For example, the Prince Edward County, there is a community clinic there that is primarily for the residents in Prince Edward County. There have been pap smear clinics across 6 communities in the region, and we continue to work to put the proposal together for when that call comes to submit the proposal. The future state, this slide depicts the future states of what the primary care strategy for the region will look like. On the diagram, you'll see the goal is for access and attachment for all residents in Belleville. What we've done is to divide the region into what we're calling neighborhoods. So from the slide, you'll see we have Belleville and Tannenegah, Prince Edward County, Quinte West, Center Hastings, and North Hastings. Within each community, there will be neighborhood access clinics. And the goal of these clinics are to provide primary care for the unattached patients initially. And then the plan is to expand the clinics. These clinics will be staffed by physicians and nurse practitioners and supported by allied health team, such as registered nurses, physiotherapists, or dietitians. The goal also of the future model is to expand and optimize the allied health teams. What that means is that all current team-based programs and services will be available for both rostered and unrostered patients as appropriate. We are anticipating that there may be need for net new resources so that all patients can be rostered to a team which will be specific to their needs. Now, we have also anticipated that there is value proposition for the model that we are proposing. We are expecting to have value for the community and for providers. For example, the community will realize more timely and equitable access to care in their own community with better outcomes. Also, individuals will have care provided by a provider and a team that is wrapped around them and allow them to develop that relationship with these team, which enhance the continuity of care. Also, the whole person care will be implemented, which will also address the social determinants of health, so patients will be linked to the social services within the community. And we're hoping that this will create a peace of mind for the community because there will be access to preventive care and health education when it is needed. Similarly, there will be value from this clinic for providers. For example, providers will be able to spend more time practicing within a team-based model rather than trying to run a business or navigating the healthcare system and social services. There will also be a benefit of schedule flexibility, the intention to have a shift-style work in the neighborhood access clinics, and the providers will benefit from the interprofessional teams because each individual professional will have skills, knowledge, and expertise that can support that care. There will be better work-life balance, and there will be improved patient care and care for the community when these clinics are initiated. So what is next?
Sure. So what we hope to realize is we hope to use this model to allow the human resources, the health human resources that already exist in our community to provide care to patients without necessarily having to add them to their own practices that exist currently. So we're looking for net new resources from the province to allow us to be able to do that in a flexible way. We're also hoping to allow people who are in the healthcare workforce but not practicing cradle-to-grave primary care at this time to be able to come into this model in a flexible way. So this might be early career physicians, late career physicians, people who might be thinking they need to take parental leave, people who might be trying to retire, people who are working part-time doing primary care, say, on the base, people who are working in our emergency departments who are trained in primary care but don't practice primary care. This would allow some flexibility to bring those people into service for this community and sort of enhance our overall health human resources going forward. We are anticipating a call from Ontario Health for proposals. At this time, we do not have that RFP, and we do not know what the criteria will be that they're looking for. We plan to finalize our model once we receive that and tailor it to whatever criteria comes from Ontario Health. The last time there was an RFP that went out, none of the proposals for this region were funded. This time we're hoping to have a unified proposal from all the stakeholders within Hastings and Prince Edward, and we're hoping that we can receive endorsement from all of our communities within this region as well to bolster our chances of getting approved. And so we thank the council for hearing us on this, and if there are any questions, by all means.
Questions for the deputation. Councillor Carr.
Thank you, Mayor. Thank you for your presentation. This is great to see, and we spend a lot of time talking about primary care here at the municipal level, and really not our jurisdiction, but sometimes when the province sits idly, we have to fill that gap. Could you just tell council and explain the last proposals that went in? You said there was no success here locally. How long ago was that, and was it more of a segmented approach?
Yeah, absolutely. So what happened was there was that RFP went out in fall of 2023. There was a small amount of money that was on the table, and it went out province-wide. There was really no guiding criteria put out at that time, and so a lot of organizations put out requests for additional staff for their organization for sort of increases to their own base funding. It was very segmented, and it was. But that said, it was coordinated insofar as we provided our region's health statistics for all of the groups participating and helped them in the proposal writing process.
Okay, and so in addition to the suggestion that primary care that already exists, those resources, and being able to come in and out of this model if they're doing other things as you described, Do you also see this as an opportunity to attract primary care to those neighborhood regions as you describe?
I think so, yes. So part of the barrier to starting a practice is the business part of the practice. It's finding space for lease, finding staff, writing staff contracts, doing leasehold improvements, renovations, making sure you comply with public health standards, and the list goes on. And this would take all of that off the table for new graduates and sort of present a much lower threshold to entering practice.
Okay, that's good to hear. And then my last question through you, Mayor, is so once you have the RFP and you're able to finalize the plan, is your intent then to come back to municipal councils with that final plan to get an actual official endorsement?
That would be our intention. We were hoping that there might actually even have been an announcement by now, but that hasn't happened.
Okay, well, we'll wait for that. Thank you very much.
Councilor Millet.
Thank you, Your Worship, and thank you, Dr. Pincock and Ms. Clayton-Babbs for your presentation. It's very informative. I know that we've discussed ad nauseum the shortage of physicians and that sort of thing and the shortfalls, but some of your statistics that you provided today are quite jarring. In particular, some of the figures double, triple, and more of the provincial average in some areas. Now, I noted that 82.3, I believe I got it right, per 1,000 for chronic obstructive pulmonary disorder, or COPD. Is that reasonably right?
Per 10,000, yeah.
Per 10,000, I thought that was a little high for 1,000.
Yeah.
Still, it's quite high and it's alarming. How are we in the area of recruiting respirologists and the needed specialists to address those conditions? My first questions, and then I have a follow-up.
Well, at the moment, we have had intermittently respirologists in our region. Right now, we do not have a full-time community respirology clinic. We have respirologists who practice at Quinte Health, but not in the capacity of providing community consults at this time. So we are reliant on those that work in Napanee and Kingston for the most part.
So, yeah, and that's a problem. My other question through you, Your Worship, the incidents, and I don't know, I probably shouldn't be asking you to posit this, but the incidents, and we've seen these and having been affiliated or on the health unit or covering it in the past, we have increased incidents of smoking here, obviously. This is a bad area for, people like the lung darts in this area, and they're cheap. So is this a problem because of the prevalence of smoking in the region primarily? Because I don't see any smokestack industry here that's contributing to COPD, as in places like Windsor or other areas.
Yeah, I can take that one relative to the COPD and smoking. And yes, I think the rate of smoking in the area is contributory to the COPD population that we currently have.
Yeah.
The other would be probably just relative to other regions around here, advanced age.
That too.
Yes.
Yeah, we are a creaky old bunch. Thank you very much. Thanks.
Councilor Enright Miller.
Thank you, Your Worship. Through you to our guests, thank you so much for this presentation. I'm very excited to hear about this, and we have heard so many times at the podium our doctors talking about running a business and getting away from the practice. And this model looks to me like a perfect alternative for this. So thank you very much, and please keep us informed as to when you need our endorsement, because I think everybody around this table would happily endorse this model. So thank you very much.
Councilor Brown.
Thank you, Your Worship. Dr. Pincock, Ms. Clayton-Babbs, thank you very much. My question is specific to around the community access clinics. So I've been following what's happening in Prince Edward County. We just read that it's now considered to be award-winning in terms of the model that they've undertaken there, so that's very encouraging. But you talked about someone else goes in and gets the practice ready, meets all of the standards, goes through the checklist, and then I assume recruits the doctors and nurse practitioners. Who is that someone? Where will this be attached to?
So this is the advantage of having something like the Ontario Health Team. This is actually where we can have a community of practice that comes together and actually builds something like this. So yes, we will need some sort of clinic administrator, but generally speaking, within our OHT, we have a primary care council. Other region, the formula that the Ontario Health wants to call it is a primary care network, but it's a community of practice of practicing primary care providers, and that's where we're hoping to be able to sort of do a lot of our recruitment from within the medical community.
Thank you.
Councillor Kelly.
Thank you, through you, Mayor. Thank you very much, Dr. Pincock and Dr. Karen Clayton-Babbs for the presentation today. I happen to sit on the Hastings Prince Edward Public Health Board as a representative for the City of Belleville, and they've released their Community Health Profile 2024. It's on their website, and I encourage people in Belleville and Prince Edward County and Hastings to actually go check it out. There was a question coming. I just wanted to say we have the second highest percentage of residents that are food insecure. The average age that people live in our area, 80 is the age, 78 for men, 82 for women. Another interesting stat, and I encourage people to go to the public health and check it out. We have the biggest demographic, 20% more than any other part of Ontario, 65 plus. The average age in Belleville is 49. So we have an aging demographic. We know that, we see that people are moving to our community, and the biggest challenge for those that move to this area, Doctor and Dr. Babbs, is primary care. We know the numbers seem to fluctuate. We were told early fall that it was 22,000 for our area. Now we're hearing it could be as high as up to 28,000. So when people come to your community to live and reside, the number one thing is health. They want to make sure that they have access to healthcare, good schools, and parks. So, Doctor, you mentioned, your words were, we don't have the materials to meet their specific needs. I was hoping that you could expand on that, please.
Sure, and I think when I said that, I was, so that goes to the social determinants of health, right? So this is food security, this is having transportation to and from appointments, this is having, being able to, purchase medical equipment that isn't covered by some insurance plan. This is what we're talking about when we're talking about sort of material needs.
And last Tuesday at the Mohawk Community Center, there was an Ontario Health Team workshop, if you will, with a lot of different agencies. How close or should the relationship be stronger with health in our community with many of the outside agencies like the John Howard Society or some of the other groups that work with mental health and are all part of that health community? Should there be stronger relationships?
There should be stronger relationship, and that is part of the work that we're doing. We involve, not all, the majority of the stakeholders who provide care or social services, and one of the aim of working together is to build those relationships.
We know that the Ministry of Health has the biggest budget. So you mentioned, Dr. Pincock, that you reached out in 2023, you did a proposal. So we're coming into 2025. I know my work on public health that they put, with the merger coming up in Ontario, the proposal was made April 2nd of this year, and it's November 13th, and yet to hear back from the province if this merger is going to go with the two other parts of Eastern Ontario. How much was the ask, and when do you hope to hear?
So at this point in time, we don't have a firm ask. We will tailor that when we find out. So last ask in 2023, I think was, there was a total of just under $40 million for all of primary care in all of Ontario. That said, they funded, I think, about 10 projects through all of those submissions, and I'm fairly certain there were hundreds.
Okay, and finally, Dr. Babs, coast to coast to coast, it's Nurse Practitioner Week. If you could do 1 minute, just to update everybody on what's happening in Belleville with your team.
Yes, you're correct. At Nurse Practitioners Week, we are not necessarily doing anything special. We're just celebrating internally, and the work continues to provide care for patients.
I just was hoping that you could mention, real quick, Mayor, how many patients you have, how many nurse practitioners, RNs that make that machine work?
Currently, we have 7 nurse practitioners and 3 RNs. It's a team-based model. So we have nurse practitioners, registered nurses, chiropractor, dietitian, social workers. So that's what is currently there. And our total population, we have capacity for 5,080. We are currently not at capacity, but registering patients.
Thank you.
You're welcome.
Councillor Thompson?
I'll, just a couple of quick questions. Since I've had some, and when you talk about COPD, unfortunately I had COPD, asthma, and angina all at the same time. So I've been trying to make some contact with my care team downtown. So your project, is it anything like the my care team downtown? Or that's a total different operation?
So my care team, who's part of your, actually, I'm not entirely sure. Our project would be separate because but my care team, is that your family physician? Is that? No.
I went there because the cardiologist.
Oh, okay, yes, I know, okay. My care cardiology team, yes. So that's a cardiology clinic. And their cardiologists are based out of, I think, Oshawa, Durham region.
They are.
And they're great people who I also refer to. But so we want them to be part of our community of practice, but because they reside in Durham, they're part of a different Ontario health team, right? So we have these barriers, and we need to. This one of the areas we need to break down is like these barriers, because we're all kind of working towards the same goal.
Yep.
But we're all doing it a little bit separately still.
Okay, thank you very much.
Any more questions? Seeing none, I need a motion that the deputation by Dr. Rob Pincock and Karen Clayton-Babb on behalf of Hastings Prince Edward Ontario Health Team providing an update on progress and developments be received. Moved by Councillor Millette, seconded by Councillor Carr. All in favor, carried. Thank you very much. And I see we have a former councillor in the chambers here tonight. I see former Councillor Miller hiding back there, 3-term councillor, and I think you're here to get the band back together, Jack, tonight, or for a play. But I'm sure you're with the next deputation, which we have Jen Barrett, representing Hastings and Prince Edward Learning Foundation, is making a deputation to council. And Jack, you're on the other side of the table tonight, so great to hear you, great to see you.
Nice to see you too, Your Worship, and members of council, and thank you very much. Last time I presented to council, it was the previous council, and I was at the front end of a $20 million police budget. I assure you today won't be quite that as expensive. I was where you are right now for the better part of 12 years, and I understand the budgetary pressures that you are under. I listened to many a deputation like this one that requests city support from deserving organizations that offer critical programs to our community. And I understand better than most, there's only so much you can do. I'm here because Food for Living is one of the most basic and yet one of the most critical programs being offered to almost 2,700 students in Belleville every day, not in Hastings, Prince Edward, in Belleville. Access to nutritious food that they would not otherwise have access to while they're in school. And the benefits are undeniable. You will hear about that. The city has supported this program through Feed the Meter every year. Today you're going to hopefully learn a little bit more and ask some questions. I know you have the brochures. I'd like to introduce Kelly Brace. She is the Executive Director of the Hastings and Prince Edward Learning Foundation, and she's joined by Jen Barrett and Board Chair Jeff Cudmore. So here's Kelly.
Good afternoon. Thank you so much for the opportunity to be here today. I'm really pleased to be able to share with you some details about Food for Learning. I'm with the Hastings and Prince Edward Learning Foundation, and we offer programs that reduce barriers and obstacles for students so that they can reach that graduation stage at the end of grade 12. Not only do we offer programs, we offer support to the Hastings and Prince Edward District School Board that also contributes to student success by filling in the gaps for things that the government doesn't fund. Things like technology, for example. Last year we funded students who didn't have Chromebooks. That's a really important part of 21st century learning. So much like a hospital, the government provides funds that keep the lights on, that have the building, that pay the staff, but they don't provide everything that students need. And that's where the Learning Foundation comes in. Before we dive in too deeply into Food for Learning, I really want to express, as Mr. Miller was saying, our gratitude to this council for the many years that you've allowed us to use your parking meters to invite the community to support our programs through the Feed the Meter campaign. It's become a holiday tradition here in Belleville, and bringing people downtown when parking is free not only helps the downtown core, but when people put coins in the meters, it helps us significantly as well. We appreciate this partnership, and it's been going on since 2007, and we're looking forward to a great campaign again next month. So Food for Learning. Food for Learning programs provide breakfast, snack, lunch programs in schools throughout Hastings and Prince Edward counties. The programs are universally accessible to all students, and they're offered every single school day. We know that when children are hungry, they can't learn. And we all know, as it's approaching dinner time, what it's like when we get hangry. And it's no different for children. However, when children are hungry and they're in school, they're still expected to perform in the classroom. And that's really not a fair expectation. It's no secret that food insecurity is at an all-time high in this area. We heard Councillor Kelly refer that Hastings County has the second highest rate of growth of food insecurity in the province. And with food costs higher than ever, families are struggling to make ends meet. Food for Learning is critical. It's critical to make sure that all school-age children and youth have the nourishment they need to thrive. Here are some photos of some smiling kids. These are pictures of local programs. And you can see from these photos that the food that's provided, they all meet a very high nutritional standard set by the Ministry of Children, Community and Social Services. There's many reasons why students participate in Food for Learning programs. Maybe they had a long bus ride and they're still hungry when they get to school. Some are looking for a safe place to go. I can remember one little girl telling me that she made her first friend at a breakfast club. And sadly, for way too many students, there's just not enough food at home. Food for Learning not only fills stomachs, it addresses the need of the whole child, their social, physical, and emotional well-being. And school staff can agree, as you can see from some of these stats here on the slide, that student nutrition programs are about more than food. They help students be engaged in their learning. They help increase student and youth sense of belonging. They provide an opportunity for students to be connected to their school and helps develop lifelong healthy eating habits. And all of these have lingering impacts on students, on their families, and on the community. Currently, 1 in 4 local students are participating in a Food for Learning program. Research shows that student nutrition programs impact students with decreased absenteeism, higher math and science scores, increased feelings of good health, and higher levels of achievement. And I know this to be true. I'll tell you a little story about a school that we have right here in our district. Their average absentee rate was 15%. 15% Monday to Thursday, except on Friday it was 25% absentee rate, which means that their students were missing one day out of every week, or 20% of the school year. They cannot succeed if they're missing 20% of the school year. So that principal is trying to decide, how do we get kids back in school on Fridays? The school has a breakfast program. The program offers cereal and yogurt and fruit. But he thought, what if I did a hot breakfast? So he painted on the windows of the school that faced the road, free hot breakfast every Friday. And in 2 short months, that absentee rate in that school went from 25% to 8%. So we know that food brings kids in school. Program activity has increased significantly, as has the cost of food. Last school year, the cost of food alone to support food for learning programs here in Belleville was over $340,000. And as I mentioned, 1 in 4 students, or here in Belleville, every day on average, 2,686 children are participating in a food for learning program. So let me say that again. Almost 3,000 kids are relying on these programs every single school day. We're not telling you anything you don't already know. Children and youth are facing obstacles that no one should have to. Food insecurity, homelessness, unemployed parents or caregivers, low family income. These are real challenges faced by too many local students. Our priority is, despite all of these challenges and obstacles, is to keep students in school. Through education, they can change the trajectory of their life. It starts with something as basic as a healthy breakfast at school. We need to invest in our children, providing support every step of the way, from kindergarten right through to grade 12, so that every student gets to experience a graduation day. Jeff.
Thanks, Kelly. We're here seeking your support for the Food for Learning programs, but let me first talk about the benefits to you, the council, and the community. An investment in Food for Learning is an investment in Belleville. As you know, I'm a retired educator and academic, and I can assure you that there are piles of studies and very compelling literature that conclude that hunger has huge negative impacts on student learning and student success. So let's just imagine that you come to school hungry. You find it hard to focus on what's being taught. You don't do as well on tests as you probably should, and you may skip school. Your family may be stressful due to family financial pressures. You may not graduate. Without a grade 12 diploma, you may be underemployed or unemployed. There's an increased likelihood of you needing social services. Your ability to contribute to the Belleville community may be reduced. On the other hand, when you're fed at school every day, you're no longer hungry, you're ready to learn. You find it easier to focus. You perform better on tests. You have better attendance and better outcomes. Your family experiences less food insecurity at home, and you are far more likely to graduate and pursue further studies. In the long term, that means improvements for Belleville, increased graduation rates, decreased food insecurity in our community, improved health and reduced health complications. A more educated workforce locally has a positive impact on the community, and this helps to attract people to this community. One of the best investments you can make for the future success of Belleville is an investment in our children, which starts with a healthy meal at a Food for Learning program. Our current reality is that we cannot keep up with the rising costs and increased demand for Food for Learning programs. With food costs being so high, more students are participating. With food costs being so high, our budget is stretched very, very thin. We're grateful for the support that we currently receive. Food for Learning receives funds from the province, but they have not increased in over a decade. Imagine if that was your grocery basket. In the spring, the federal government committed to support student nutrition programs. However, the agreement with Ontario has not yet been signed, and we currently have no idea what the details are, how it will impact, if it will impact us. We are supported by both school boards, and we have program partners such as the Breakfast Club of Canada, the Grocery Foundations. You've all done Toonies for Tummies, right? Well, that helps us here. We've been very successful in fundraising with local businesses and individual donors from our community, but we must keep looking for new and sustainable funding sources to keep pace with the rising food costs and the increased demands if we are able to sustain and grow our programs going forward. Without your support, we may not be able to fully fund programs, and even now, we have to limit the amount of food we provide, so no second helpings. Decrease the size of portions, half a bagel often, not a full bagel. Providing less expensive options like bananas, but never pineapples or strawberries. And in extreme cases, reducing the number of days a week the programs can be offered. So on behalf of the almost 3,000 Belleville students who participate in Food for Learning programs every day at school, we're requesting a 5-year commitment of $75,000 a year from the City of Belleville to help to reduce food insecurity in this community through our Food for Learning programs. Please join the other municipalities across Ontario, such as Toronto, Hamilton, Kingston, Ottawa, Norfolk, and Cambridge, who already support the nutrition programs in their communities. Mayor Ellis and Council, please help Belleville students eat, learn, and succeed. Thank you.
Any questions for the deputation? Councillor Kelly.
Thank you, Mayor, through you. Just a couple thoughts and then just some of the successes. Kelly, if I could ask you just about your corporate sponsorship in the city of Belleville. I was one time a committee member with Food for Learning, and I know there were some wonderful partners, and I think this is a good opportunity to highlight those.
Absolutely, thank you. The Belleville community is extremely generous in supporting Food for Learning programs. Just off the top of my head, to name a few, we have Reed's Dairy that donate milk in kind, so they're bringing milk right into the schools. McDowell's grocery store is donating bread, the same thing, goes right into the schools. Kellogg's, of course, they provide an annual cash grant. I could go on, the list is there. There's lots of support from Whitley Insurance is another big supporter. Finley Foods out of Kingston, which is our food distributor, they're also very generous with their distribution and reducing the cost there. It takes a village. It takes a village. The community individuals are generous when they can. You know, as we see with Feed the Meter, collecting nickels, dimes, and quarters that add up to thousands. So we get it from all corners, and we appreciate it. It's just not enough.
Yeah, and thank you, and Kelly. And the big picture is too, on every school day for Food for Learning, besides Belleville, there's 69 different schools doing the same thing throughout the area that they cover, and about 6,000 students daily. And 3,000 of those, half of that, is in Belleville alone. Right. And I know last year the province gave $73,000, and if you do the math, that's $1,058 per school prorated for the Food for Learn program.
Right, and that was one-time funding.
That's one-time funding.
Right.
So I can recall when I was at a school, and it has stuck with me for years, the principal was Brad Reitzel, and I was there for the Food for Learning committee, and this young guy came in, and it was a Monday morning or Tuesday, and he grabbed the principal's leg, and he wouldn't let go, and they had breakfast together. And I think, you know, the Food for Learning gives them that nutrition, that start, but for many of the students that use it, you mentioned 1 out of 4, that's like breakfast for them. That's their family. They're coming to school. Think of what happens to those students throughout the course of the summertime when that nutrition's not there and that TLC. So I applaud what you're doing. It's a big part of education now, and I know the 2 school boards and all the teachers involved with that and support staff appreciate the work of Food for Learning. Thanks.
Councillor Millette.
Thank you, Your Worship. Do we have the resolution on the floor to receive this?
No resolution on the floor yet.
Well, thank you very much, by the way. I wholeheartedly support the program, have since its inception. The Feed the Meter program has been amazing. I am going to move that the deputation be received and that the request for 75,000,
5,000 for 5 years.
75,000 over 5
No.
years, not 75,000 per year,
75,000 per year.
for 5 years?
Yes, please.
Okay.
If anything.
Well,
would-
okay.
Would you send that to budget, please?
That's
if you
what
don't
I,
send it? Okay, thank
that
you.
is my motion to add that to the, receive the deputation, and that the request for $75,000 in report be referred to operating budget for consideration.
Seconded. Counselor Enright Miller. Discussion. Counselor Carr.
Nothing on debate. I have a question for the deputation.
Okay.
Can I go ahead? Yes, thank you. Thank you for your presentation and the work you do. You'd mentioned, and it'll be my words, that the province isn't doing enough. I guess the question is, have you spoken to our MPPs, our new MPPs, Alsop and also Rick Barisi? We have 2 ridings in the city, which is unique and can be to our advantage. That means we have 2 MPPs that can advocate. What are they saying in terms of commitment for the government? You said that the funding was frozen for the last 10 years, which is astounding. What are they saying as far as commitment
So
for the future?
I must give credit to former MPP Smith. Jeff and I met with him early in the school year last year and expressed this concern. And he brought it to the House, and we got that one-time funding. I can't say give him all the credit, but certainly he'd speak on behalf of all students in the province needing that support. We have a meeting with MPP Alsop tomorrow, and MPP Barisi is very familiar. We haven't seen him since the Tim Hortons Smile campaign when he was decorating cookies, but we do keep in touch and provide them updates and hope that they take our concerns forward.
I would suggest that, given the fact that you are making requests to municipalities, it would be a time to revisit MPP Barisi as well, and to get that same commitment, and certainly former MPP Smith can deliver, and so our 2 MPPs have to live to that standard as far as I'm concerned. So.
Absolutely, and I'd like to note we are members of Student Nutrition Ontario, a network of all providers, and that group, they regularly send information and right up to the minister,
Okay,
Minister Parsec.
Okay, thank you.
Counselor Sue.
Thank you so much. It's Mr. Miller. So nice to see you. Rotarian Jeff, Ms. Jen. Thank you so much. And I'm a Rotarian. And every time the Rotarian, when we have special guest to speak, and Rotary Club makes to the Food for Learning program. And today I get to meet all of you. That means so much to me. Thank you so much. I just wanted to thank you, and thank you everyone.
I'll call the vote on that now. All in favor to send it to budget, carried. Thank you very much. Moving along, we have some correspondence. First one, the CP KC Holiday Train. If I could get that moved as read. Councillor Carr, Councillor Enright Miller, all in favor, carried. Next, 7-2, letter from Downtown District. Waiver of food truck bylaw, if I could get that moved as read. Councillor Enright Miller, seconded by Councillor Thompson. All in favor, carried. Motion to go in committee of the whole with Councillor Thompson in the chair. Moved by Councillor Enright Miller, Councillor Carr. All in favor, carried. Thank you.
Reports shall include reports, items that warrant individual attention from council. 8A1, Prosper Development BR plus E Manufacturing Final Report and Action Plan, EDCEV 2024-08. Resolution that pursuant to the Belleville Growth and Retention Specialist Report number ECDV 2024-08, Prosper Belleville BRE 2024, Council approved the report and action plan to support the city's manufacturing as presented. Mover and a seconder. Your worship, Councillor Kelly, any questions? Councillor, or your worship?
I just wanted to make some comments and thank the volunteers that participated in this program. I know Alicia from our economic development worked wonders with them, and thank you for. I see one in the audience. I think Jack Alexander's out there that participated in this, and if Jack, again, I know you've give a lot of volunteer hours, and there was over 746 hours of community that was given in this report. And without that community engagement, we wouldn't be able to have a report like this. So I'd like to thank the volunteers and Alicia and your department for a great report.
Councillor Millette.
Thank you. Further, your worship's his worship's comments. Sorry. I note that Ms. Watts is here, who filed the report. I would like to add that I would like to thank the volunteer chair who oversaw the process for this BRNE for the surveys and some of the deliberations. Rick Jeffrey, community member, who's seated in the audience with Mr. Alexander as well. I'm really impressed at the number of industry participation in this. 86%. When you get 86% involvement in a survey and an action plan such as this, it shows that there are two things. There are needs in our community for revisions and improvements in the way we attract and retain businesses, and the fact that these industries are engaged. So I was really heartened to see that. We have 26 action items on the in the final report, and I was wondering if Ms. Watts or could just take the podium for a moment and just explain how and where we're implementing that, and what the next steps are.
Hi, everyone. Through the chair to Councillor Millette. So 26 action items came out under 4 different themes. We are working in our department with a number of our community organizations who also work with the industry to implement a number of these action items. So most of those things, other than the things that, under city services that our department will have direct input working with other departments within the city. A lot of those other action items will be implemented in collaboration with our community partners.
Thank you. And just one further, I note that we have some RED funding that has been received for 2025 to execute an investment development toolkit. So that's kind of exciting as well.
Yes.
All right. Thanks very much.
Any other questions? Councillor Kelly?
Thank you. Through you, Chair, as the Chair of the Economic Development Committee for the City of Belleville. Thanks to Alicia and the team for putting together the reports that we received. Victoria, question for you. If you can kind of just explain an action item, people at home that are watching may not be privy to the paper trail. Maybe you can just explain what that action item means or give an example of one.
Sure. So as part of the BRNE project, as a community, we met to review a number of data that came out of our surveys. And in that meeting that we met, it was called a data retreat. We had community members who support industry, and we also had industry members. And together we reviewed that document, the data, and came up with a number of action items that they wanted to go forward as priorities. As I said, there were 4 themes. One of those action items that I can talk about today was under business supports, and it was talking about attracting youth and promoting manufacturing with youth and skills trade in our community. So one of the action items that came out of that was that we would be working with community partners like QEDC to bring the Ontario Skills Truck to our community so that the youth in our community can have that experience and understand what skills are involved in manufacturing and what manufacturing is about. So that is one example of an action item.
Any other questions? Councillor Carr?
Yes, thank you. Just one question, and I got a couple comments. With respect to attracting and retaining labor, and particularly skilled trades, what role, because it wasn't clear, what role would the local school boards have? Because I think really and truly you got to capture the students early. I know as chair of the library board, we've even talked about enhancing our tech space in the library just to get children to start to explore, you know, circuitry, robotics, that type of thing at a very rudimentary level, but again, to spur on that attraction, so in hopes that they, you know, get to high school and could get into some type of program that's geared towards that and then on to a particular trade. Do you see the pickup or the reception from the local school boards and being a partner in that skill development?
Through the chair to Councillor Carr, absolutely. This is in fact, actually, I had a meeting the other day with school boards, and we're meeting in another couple of weeks about the whole co-op program and how we can look at getting industry more involved, looking at how we can really get students in our community, and looking at manufacturing and all trades really, but manufacturing that came out of this report as a viable career path.
Okay, and that's great, Mr. Chair, to hear that, because and I think co-op is an excellent program that really should be pursued in school. It's an opportunity for students to try out a particular career to see if there's interest, particularly before you start spending money on courses and whatnot. It's maybe a good test drive before that money's being spent. The other comment that I was going to make that was very astounding and as I read the report is the fact that our manufacturing companies have recognized the lack of affordable housing. So when we talk about attracting and retaining, obviously we don't necessarily have the workforce that's here, so we need people to move here, and then they need a place to live. And I've said this before in other meetings where we can't just look at business attraction, retention, and silo. We have to make sure, and businesses are seeing that their employees are taken care of, and one of them is housing. And so I would hope too that through this we would see engagement with our home building sector, and understand the fact that not only is there a need for more homes because of the attraction that we need to have for these businesses to thrive, but also at an affordable level that corresponds with the wages that are being earned in our industrial park and throughout the city. We can't be building McMansions for folks that are working in the manufacturing. The salary simply doesn't line up with the price of a home, and so that needs to be corrected. And having affordable homes is what's going to make our manufacturing sector thrive as well. So, thank you.
Any other questions? All in favor? That's carried. 8A2, Belleville Economic Development Strategic Plan, ECDEV 2024-9. Resolution that pursuant to the Manager of Economic Development's report number ECDEV 2024-9 Belleville Economic Development Strategic Plan, Council approve the 4-year plan as presented. Motion by Councillor Kelly, Councillor Enright Miller. Any questions? Not, all in favor? Thank you. 8A3, Belleville Economic Development Brand Identity, DEC DEV 2024-10, resolution that pursuant to the Manager of Economic Development, report number DEC DEV 2024-10, Belleville Economic Development Brand Identity, Council adopt the project as presented. Motion, Mayor Ellis, Councillor Millet. Any questions? Councillor Millet.
Thank you, Chair. Through you to Ms. McGuire. Can you just quickly give me an overview of the brand identity that are we talking about possible new logos or anything for the city or for various departments of the city, or is that just an oversimplification of this? I'm seeing the presentation, I've read it a couple times, and I'm still not 100% clear on what we're doing with, physically with this.
Through the chair to Councillor Millet, yes, happy to clarify. So this is not a city-wide brand. This branding exercise is specific to Belleville Economic Development. So it's providing us a toolkit that will assist in communication, marketing, and really creating awareness and connecting with the businesses and different sectors that we deal with on a day-to-day basis.
Any other questions?
Yeah. So,
Councillor Millet.
yeah, further to that, am I to take it that the BIQ then is our new brand for the, yeah?
Yes, that's correct. So we have a long form and a short form, as it's referred to in branding. The long form is Belleville Economic Development with the IQ beside it, and then the short form is the BIQ. So we will have a full brand guide delivered to us, outlining exactly how that is used from font to colors and in terms of logo application.
Great, thank you.
Any other questions? All in favor? That's carried. 8A4, Pop-Ups in the Bay 5-Year Operation Plan, ECDEV 2024-11, resolution that pursuant to the Economic Development Sector Specialist Report, DEC DEV 2024-11, Pop-Ups in the Bay 5-Year Operation Plan be received. Councillor Enright Miller, Your Worship, any questions? All in favor? Oops. Oh, Councillor Brown, did you have a question? Okay.
Thank you, Chair. My question is for the Manager for Economic Development, Ms. McGuire. First of all, I want to extend my thanks to Alicia and her team in giving me an opportunity to plead my case as it relates to pop-ups, because I know that in the past I've asked a number of questions, not always questions that are easy to answer. My first question, and I know the answer, but I'd like to have it shared with my fellow councillors. When do we expect the pop-up program to break even?
Through the chair to Councillor Brown. So an attachment to the report includes a 5-year financial forecast. And the answer to that question is that we don't see it as a program that will break even. What we've tried to communicate through this report, and I want to recognize Michelle Lotion, who's our tourism specialist coordinator, who has created this operating plan and co-authored the report here, and is overseeing the program moving forward, is that what we've tried to illustrate here is that there is community benefit to pop-ups on the Bay. There are a number of themes that we've outlined and objectives that we meet through the Pop-Ups on the Bay program. But at the end of the day, there is a community benefit, and we are recognizing through this report that there is a cost to that. So it's not something that we are presenting as a breaking even program.
And if I may, just as a follow-up, I also want to acknowledge, I think how the program itself has evolved over the course of time. We are having some good discussions in terms of what's, in addition to the community benefit, what is it we're actually trying to accomplish in terms of the contracts that we sign every year with the businesses. So thank you for acknowledging. I did pick up the fact that we have those that are doing a proof of concept, the young entrepreneurs who want to see if it's even something that would be successful, versus another caption of people that are interested only to do their business on a seasonal basis, so through the summer months. And then we also have a third category, which is existing businesses within the city of Belleville who are using it as a secondary location, in some cases to market their business or to grow their business as well. And then through the shoulder season, ideally you would see those people you've attracted through. And so I thank you for that conversation about thinking differently about not only the businesses that we bring into the pop-ups, but the fees that are associated with that, so that it's not a flat fee all the way across. We saw some of that in '24 with the food truck rate being different than the other vendors. So I want to thank you for acknowledging that there's this equal opportunity in terms of if it's a seasonal business or whether it's a proof of concept, that we need to think differently about the businesses going through. Thank you for that. But one final question. Are we looking to expand the pop-up programs beyond Zwicks Park?
Through the chair to Councillor Brown. So something that we're looking at doing, to answer that question, is we are not looking at an expansion plan to the infrastructure that is at West Zwicks Park. What we are looking at is how we can better utilize other capital assets that we currently have, which include the holiday huts. Currently, they are only being used over a 3 to 4 week period during the holiday season. So we're currently assessing how that can be utilized and incorporated into the real estate contract that's included in the report in terms of activating that asset through different times throughout the season and helping connect areas like Myers Pier, pop-ups on the bay in West Zwicks Park, and the downtown area. So that is still something that's under review. It's something that we look to include in the contract, but it is all represented in the cost that we've provided here.
Again, just thank you to Alicia and her team for putting this together. I really appreciate the depth and the conversation that Michelle, Alicia, and I were able to have about this report.
Thank you, Councillor Brown. Any other? Councillor Kelly.
Thank you. Through you, I was hoping to call Michelle up, if that's possible, from the tourism team. First of all, Michelle, thank you for the report, the 5-year plan. So it's going to cost the city about $100,000 a year, $98,400 according to your report. I totally get the benefits to our community, and it's a real attraction with the pop-ups at West Zwicks Park, with the energy, the vibe. It's a destination families can go. It's affordable. The music this past Friday, Summer on Fridays, was fun, added atmosphere to it. Maybe it's too soon, but how did the pop-up vendors do this year?
To the councillor, through the chair, first of all, good afternoon or good evening, everyone. I'm Michelle Ocean, Tourism Sector Specialist, Economic Development. The pop-ups at the end of the year, we conduct a vendor survey, and so we are able to get feedback from each of the vendors. And this year we had responses from 8 of our vendors out of the 13 that participated. We have recognized that they have all experienced an increase in sales in total revenue. Average total revenues were close to $15,000. And we've also recognized improved marketing efforts on their parts in terms of their social media and digital media strategies.
Thank you. And one other, some of that bump up in sales and business, this past summer, we had a few more events down at West Zwicks Park, and there was a good buzz going on there. So do you feel that that might be a destination for more events to go to help the pop-ups?
Absolutely. Some of the feedback, again, was that the events held at West Zwicks Park definitely benefited the vendors and their sales.
And finally, Michelle, I was speaking to Adam on the way into City Hall today for the meeting. He's with Horwood Electric, and he was setting up the pole to make sure that the holiday huts will be ready to go in a few weeks. That's got to be exciting too.
It is absolutely exciting, and it gives us the opportunity to test the holiday huts and the potential that they have for activating the city. And I would like to thank all city departments, in particular TOS, who's been very supportive of our activations throughout the year. Thank you. My pleasure.
Any other questions? Councillor Millet.
Thank you, Chair. Through you to Ms. Lochin or Ms. McGuire, whoever can answer my question. Through this latest process, have we determined, let me back up a bit. I think when this was first the brainchild, I believe, of former councillor and current member of Parliament, Ryan Williams, back in the day, this was designed as an incubator, if you will, not only as an attraction for tourism, but as an incubator for businesses. And is there anywhere, and I kind of looked to see, I may have overlooked it, is there any change in strategy of, at some point, if these are new businesses down here, or if it's an extension of a bricks and mortar business that's, you know, also they run, let's say they run a restaurant somewhere, but they've also got a pop-up. That kind of sounds to me like it's a little counterintuitive for the notion of the business incubator angle. So whoever can answer that, I'm just wondering if it's now just entirely, we don't care if they've got a bricks and mortar or if they're just starting out, or was there any emphasis on that, or is it strictly more of a tourism attraction event?
We see the property, as mentioned in the report, as a community service. The city has a priority to build the tourism sector, and so businesses will be better vetted that meet that criteria, giving enhancements and space at what is considered a tourism location in Belleville to really test their products there and see what kind of draw it does lead to.
Any other questions? All in favor? That's carried. Thank you.
Thank you.
8A5, execution of pre-servicing agreement, Settlers Ridge East subdivision. Thank you, Your Worship. A seconder for that? Councillor Enright Miller. Any questions? All in favor? That's carried. Thank you. Got through that one. 8A6, life insurance for doctors under contract. MPRR 2024-24 resolution that a manager of recruitment and retention report number MPRR-2424 regarding the requirements to purchase life insurance coverage for physicians under contract with the city be received and approved. We need a motion to receive. Your Worship, Councillor Enright Miller, any questions? Councillor, Your Worship.
Just one, I see that our physician recruiter manager, Karen Post, is here tonight. And I just wanted to, again, we signed number 10 a little while back, or number 11. How is it out there? How are any more coming, or any good news, or how busy are you? And that's, I'll just leave it at that. Thank you.
Ms. Post?
Through the chair to His Worship. It continues to be very busy. It is a tough slog for sure. There's a lot of competition out there and not nearly enough recruits to choose from, for sure. We have significant interest right now from physicians from the UK. The UK has made some changes to their national health system that do not sit well with many family physicians, so we have lots of interest right now from physicians, which is great. I have 17 that we're working with right now, which is great. The biggest challenge we have is immigration for these physicians. In order to get them to apply for either a work visa or permanent residency, they need a labor market impact assessment, or an LMIA. The employer has to do the LMIA, and of course physicians are independent contractors who don't have a specific employer, so our biggest stumbling block right now is figuring out how we can get these folks a visa or permanent residency when we, the city, cannot do the LMIA. So we're working through that right now.
Thank you, and you're busy, that's good.
Yes.
Any other questions? All in favor? That's carried. And we move into consent items. Council may adopt. 8A7. Oh, sorry. 8A7, Annual Director Financial Treasurer's Report pursuant to Section 284 of the Municipal Act, RSO 2001, DF 2024-18, resolution that the Director of Finance Treasurer Report number DF 2024-18, Annual Director of Finance Treasurer's Report pursuant to Section 284 of the Municipal Act, RSO 2001, be received. Need a motion, Your Worship. Seconder, Councillor Enright Miller. Any questions? Councillor Millet.
Yeah, just one correction on the attached chart. I noted that it gives various statutory provisions for remuneration, that sort of thing. Several of us around this table are on Quinte Conservation. I'm shown as having received an amount for remuneration for per diem or mileage, whatever it may be, for Quinte Conservation. I donate my per diem and mileage back to Quinte Conservation. So the figure that's in place there is in error, just for the record. I'll reach out to Treasury and or Quinte Conservation to make that right going forward. I just noticed that that's there, and it's either an error at our end or it's an error at the Quinte Conservation end. So thank you.
Any other comments? Not, all in favor? That's carried. Thank you. Now we move on to consent items. Resolution, the council may adopt consent items by one motion, but prior to consideration of such a motion, members may request specific items be removed for consideration upon under such motion, and council shall consider such items individually. Your Worship?
No, thank you.
Councillor Carr?
No, thank you.
Councillor Enright Miller?
No, thank you.
Councillor Sue?
No, thank you.
Councillor Brown?
No, thank you.
Councillor Millet?
No, thank you.
Councillor Kelly?
No, thank you.
Beautiful. Pardon? Oh, okay, I gotta read the resolution. The council item be approved with the recommendation that, where is that? The council, okay, that council accept the items under 8B. Councillor Mayor, Councillor Millet, all in favor? That's carried. And move on to the exciting part where I move out. And 8C, council may adopt consent items by one motion, but prior to consideration of such motion, members may request that specific items will be moved from consideration under such motion, and council shall consider such items individually. And going around the table, Councillor Kelly?
No, thank you, sir.
Councillor Millet?
No, thank you.
Councillor Brown?
No, thank you.
Councillor Sue?
No, thank you.
Councillor Enright Miller?
No, thank you, Chair.
Councillor Brown, or Councillor Carr, sorry.
No, thanks.
Your Worship? Thank you. And items received in corporate office department may now be of, so what do I do?
Yeah, you just want to read it, but you don't have to say with the exception of, because it wasn't.
That the agenda items be received. Mover, Councillor Carr, and your Councillor Kelly, all in favor? That's carried. And the next motion is to rise and report. Councillor Kelly, Councillor Millet, thank you very much, folks.
Thank you,
And all in
Councillor.
favor? That's carried.
Thank you, Councillor Thompson. Bylaws, first reading of bylaws, bylaw 2024, 183, 184, 185, 186, 187, 188, and 189. Moved by Councilor Wright Miller, seconded by Councilor Brown. All in favor, carried. Second and discussion. 2024, 183, 184, 185, 186, 187, and 188, 189. Moved by Councilor Brown, seconded by Councilor Thompson. Discussion. All in favor, carried. Third and final reading of bylaws 183, 184, 185, 186, 187, 188, and 189. Moved by Councilor Wright Miller, Councilor Brown. All in favor, carried. New business. Councilor Millet.
Thank you, Your Worship, and I'm simply requesting a staff report, and I've given a copy of the request to Deputy Clerk. I would ask that staff prepare a report for council at the conclusion of either the first full 9 months of operation of speed enforcement cameras in the city of Belleville, or a full 2 relocation cycles of the cameras, covering but not exclusive to the following. I'd ask that in the report, costs incurred for processing appeals, payments, and other administrative requirements for City of Belleville or Hastings County POA staff. I would ask that it include as well full accounting of the revenues generated in the reporting period, full number of infractions in total issued to motorists, full reporting by police or other agencies of incidents that may have occurred, such as collisions or personal injury accidents in the same period, prior to the reporting period as compared with those incidents during the reporting period. I.e., how many incidents have the cameras and their usage caused to be averted. And finally, a report from Police Services or Police Services Board on the overall assessment of the effectiveness and benefits of the cameras. So I would ask that that report come before us whenever those 2 periods are done, either 9 months or 2 full cycles. We're, I believe, moving the cameras in January, are we? Thank you. So as those, I'm not sure of how many months they remain in place, but 3 months. So after the second 3 months or 9 months since implementation, that we have this brought back before us, and I'll further speak to it when we receive that information. Thank you.
Any more new business? Wright Miller?
Thank you, Your Worship. I just wanted to let everyone know that on behalf of the Accessibility Committee, we are hosting again this year, Getting the Most Out of Your Personal Income and Benefit Returns from a Disabled Perspective. And this year, November 28th, from 6 to 7:30 at the Public Library, we will have Ontario Minister of Finance expert Jeremy Bertrand speaking and helping everybody out. He will explain physical and or mental impairment, how it can impact what is claimed on your tax return. So we have a QR code. We've been advertising it. Anybody that would be interested, please sign up, and we hope to see anybody that's interested there. Thank you.
Thank you. Anybody else? Seeing none, moving along, motions. So the motion is full disclosure of construction costs on new homes, whereas the purchase price of new residential homes in Ontario has seen hyperinflated increases, making it unaffordable for most residents, whereas municipalities are required to provide detailed information regarding the collection of charges and fees for new residential construction, and including those outlined in the Development Charges Act, and whereas developers and builders have called for a decrease in government taxes and fees to reduce the cost of new residential builds, and whereas it cannot be determined or guaranteed whether any savings would be passed on to the purchaser without the full disclosure of construction costs on new residential units. Now, therefore, the City of Belleville requests that a Government of Ontario pass legislation that requires all developers and builders to provide a full breakdown of construction costs on each new residential unit, and that the full breakdown include costs related to land purchase, site development, including water, wastewater infrastructure, foundation framing, electrical, plumbing, truss and roofing, and all interior finishing, and that this breakdown clearly outline any factor reductions or savings, and that this information be publicly available for each new residential unit, and that a copy of the resolution be sent to the Association of Municipalities of Ontario for distribution to its members for support, as well as Premier Doug Ford, Minister of Municipal Affairs Paul Calandra, Bay Quinte MPP Tyler Alsop, and Hastings, Lennox, and Addington Rick Breezy. Moved by Councillor Carr, seconded by Councillor Brown. Discussion. Councillor Carr.
Thank you, Mayor Ellis, and I'll request a recorded vote now so the Deputy Clerk can be prepared. Municipalities have been the whipping post of all that is wrong with housing getting built. Complaints of slow approvals, although I will say that the City of Belleville approvals results are quite excellent. Complaints of too much regulation and oversight, which is ironically provincial jurisdiction, and municipalities are simply operationalizing acts, regulations, and codes as required by law. The Ford provincial government introduced Bill 109, which in part required municipalities to refund application fees for delays, even when those delays were the result of the applicant. Thankfully, with some AMO advocacy, this was never implemented by the province. Then the Ford government extended strong mayor powers to get housing built and created the Building Faster Fund, as Ontario set a goal of building 1.5 million homes by 2031 and assigned the province's 50 largest municipalities with housing targets to meet this goal. As a reminder, the municipal target is based on housing starts, which is a foundation being constructed, and not approvals, which is the only thing municipalities have control over. With a number of Ford provincial government housing legislation, the city is losing $2.6 million in development charges revenue this year, and annual projected loss revenue of $2.8 million in future years. As we all know, municipalities approve applications but don't build houses. Yet the accountability and measurement of performance on building is placed solely on municipalities. This despite the fact that builders will keep houses vacant rather than reduce pricing, and that is happening in our city, as I've confirmed with some realtors. And land speculators keep land vacant in hopes of an escalating sale price sometime in the future. Then the discussion shifts to affordability, and that it now is being blamed on municipalities with development charges and fees being collected. What is not explored or discussed is the cost inputs to new residential units. Municipalities have to conduct background studies, typically completed by economist consultants, as well as provide a full accounting of development charges collected and committed to fund planned growth. The Development Charges Act 1997 notes that a council of a municipality may by bylaw impose development charges against land to pay for increased capital costs required of increased needs for services arising from development of the area to which the bylaw applies. In other words, growth paying for growth versus existing taxpayers paying for that growth. The trend I'm seeing in the private building sector across the province is to complain about how high development charges are and that municipalities should reduce them for better housing affordability. Ironically, it's the private sector that bids and set pricing for infrastructure that municipalities set budgets for in order to support that growth. The growth construction costs continue to rise year over year, as evident by municipal budgets and contract awards. What's not talked about yet is the detailed construction costs for residential units. If we collectively are going to address housing affordability, it cannot be considered in generalities or remain a mystery. Again, it's been suggested in larger discussions and even at a recent Residential Construction Council of Ontario Housing Summit, which I attended virtually, where they are advocating that municipalities should be reducing development charges so that these savings can be passed on to the home purchaser. Without seeing the math, how can any municipality be confident in such action? Let's talk about things like land costs and its impact on new residential construction costs. Some lots are sold for between $250,000 and $300,000 with no shovel in the ground, no earth being moved, no hint of a house being built. I'll take a recent example here in Belleville on land speculation and its negative impact on housing affordability. The Planning Advisory Committee and then Council were presented with a zoning application for a major subdivision development in early 2022. We were presented with grand plans about how it's going to add to the housing stock. Upon the zoning approval, the land was then listed for sale on MLS for $29 million, now that it had been rezoned as residential. The only thing that changed was the land designation. There's been no moving of dirt. It's just simply a zoning change. It's now $29 million for sale. I don't know what the actual purchase price was, but probably close to that. Now, what kind of cost impact does that increased land value have on that eventually built residence? We're living in extraordinary times when homelessness, food bank use, food for learning demand are at all-time highs. No longer can you afford rent, food, and even think about saving for a down payment on your own home someday. Even young professionals cannot qualify for a mortgage because the principal amount on a house is simply out of reach. Never mind the interest rates, it's the high principal price. Hardworking residents cannot afford what is being built, and even our business community has called this out in a business retention and expansion report that we heard tonight. We're leaving a generation behind, and it is going to cost all of us in other ways. We also know that new home prices set the bar and impact the resale prices of residential units. We can't dance around the housing affordability debate any longer. It needs all hands on deck, and the private residential construction sector must become a full disclosure partner to get housing costs under control. Full disclosure of housing construction costs can bring several benefits. Transparency for buyers, promotes fair competition, informed decision-making, accountability and quality assurance, encourages sustainable practices, supports market analysis and policy decisions, and reduces the risk of overpricing and market manipulation. Industry secrets don't hold water anymore when we're talking about housing. As noted in the National Housing Strategy, housing has been identified as a right. It can take many forms, but the entire housing spectrum needs a course correction. This motion is another step in that direction. Now we need the Ford provincial government to act. Thank you.
Councillor Thompson.
I thank Councillor Carr for the motion. It has some merit, but I just can't foresee as a past retailer for bringing a cost to tell the people what that particular house cost, everything. It's a private business, it's supply and demand. That would be like me when I was in retail. That pair of pants was $80. You want to know how much that pant cost me? I don't think so. It's a supply and demand. We're in a business like everybody else to make a dollar. Maybe some are making more than others, maybe not. But to ask the suppliers to give you a breakdown of how much that 2x4, the 2x6, the roofing, everything into a cost before they sell the house, in my estimation, that's intruding on their business portfolio. You're not, hey, I'm not happy with the cost of housing like anybody else. I wouldn't want to be out there neither, starting over. But the fact is, it's a supply and demand issue, and we cannot ask entrepreneurs, whether it's housing, pants, coffee, whatever it is, we cannot ask them to supply a cost for every single item. That's intruding on their business, and it just, to me, it doesn't make sense how we could ask entrepreneurs to divulge the cost of doing anything, whether that's in retail or a contractor. That'd be like a plumbing guy come to me and saying, it's $100 to cut me. This is my cost. Do I ask him his cost? I don't think so. I just think that it's an ask that is way off base in my estimation, and I will not be supporting this motion.
Councillor Millette, then Councillor Brown.
Thank you, Your Worship, and I'll be, I too share Councillor Thompson's observations that for the most part, Councillor Carr's motion was very much laudable, and that's a lot of those points that he's raised before in these chambers, and we share those same concerns about housing affordability and the land speculation. That's a galling example, and I remember that one, and we were all pretty gobsmacked by the fact that we did the heavy lifting on that that whole housing development area, and our planning and engineering department worked diligently to get it done. We got the planning in place, and the landowner at the time Turned out to be just another land speculator out to make a buck, and a good buck he made. All that said, I don't know, maybe I'm jet lagged, maybe I've got brain fog, maybe I just can't grasp the big picture, but I cannot for the life of me see how asking for a breakdown of every nail, screw, and roofing truss is going to help increase or improve housing in this municipality or anywhere in this province. The added cost of every home just to provide the build sheet is going to be built into the price of your home. They're going to say, okay, I got to hire a department. This is builder X. He says, I've got to hire a department now to keep an ongoing itemized sheet on every house I build, and then somebody to process all of that. The notion is laudable. The actual concept is a clunker. I'm sorry that I can't support it. It's just unworkable in my view.
Councillor Brown.
Thank you, Your Worship. Having sat on the planning committee for a number of years now, I believe I'm up to 6, there has always been a great deal of emphasis around what the province wants us to do in terms of housing. We spent an exceptional amount of time, our staff, we being staff, on the new official plan, on rethinking our entire zoning bylaw in terms of how we can introduce new concepts like 4 as of right housing, changing the way that we look at accessory dwelling units and such. To me, this is just another aspect of it, and I can appreciate where some people might say, the trusses and the electrical and the plumbing. I believe that is something that we would want to have included, but as I have communicated, if we step back and look at big picture, if we in fact want to be able to create and reduce the cost of the average home here in Ontario under the provincial policies that we have, then do we have a true understanding of what are the drivers to that cost? So if you look at the spirit from what's in behind this, is it the cost of land and the land speculators? Is it the cost of development charges and the infrastructure that we as the city are obligated to put in place? Is it the actual cost of the build? We often hear that the cost of a 2x4 has gone up, and the cost of nails has gone up, and supply chain issues. And we understand all of those things, we appreciate them. But if we step back and look at it in terms of big bundles of where the costs reside, then it will give us a much better, and ideally for the province to have a much better concept of what are the drivers, the upward drivers of the cost of a home, and that's the area that we need to focus on. I have to agree with my colleague that right now the municipal levels of government across Ontario seem to be the catch-all. If we did this and we did that and if we sped it up and if we reduced our costs. Well, as it's pointed out, we are only the approval part. We don't actually build the homes. So if we really want to understand and address the problem most effectively, then I think what the ask is here is something that we should support. I appreciate that maybe asking for the bundle of nails is not the right level, and I don't believe that a bundle of nails was actually mentioned in the particular motion, but I do think if we step back and look at what is actually driving the cost, do we understand that, and how can we then focus our attention on the areas of greatest growth? Thank you.
Okay, anybody else? Councillor Card or Councillor Ray Miller?
Thank you, Your Worship, through you. This is one of those, being a business owner and looking at this out from the lens of a business owner, and I totally get the motion, and I'm on board that we need to find out how we can create new homes. Absolutely. I'm not sure that this motion really is going to give us that answer. I think as a business owner, and if we go to the developers and we say, okay, open your books, tell us what you're making, what's your costs, I don't think that's a fair for us to be doing. I think there's a different way to approach this. I'm not sure what that is. I love the idea of it, and I think it's on the right path. I just don't think in private industry, they have a lot of expenses. They know what their expenses are. Sure, there's profit built into that, but I don't think this is going to change. If they start reducing their product all the way down, we're gonna get a bad product. So I think we have to look at this through a different lens. I like the idea of it for sure, but I don't think I can support it as written. Thank you.
Okay, Councillor Kelly?
Thank you, through you, Mayor. First of all, thanks to Councillor Carr for working on this. As the chair of the planning committee for the city of Belleville, I've known Mr. Carr for years now. He's always trying to make affordable housing top of mind, so I appreciate you bringing this to the table and continuing the conversation, Councillor. So the motion is that the full breakdown include costs related to land purchase, site development, including water, wastewater, infrastructure, foundation, framing, electrical, plumbing, truss and roofing, and interior finishing, and that this breakdown clearly outline any factored reductions of savings, and that this information be publicly available for each new residential unit. So the cost of the nails are not in there. It doesn't say nails, but they're in there. So we know that this potential motion would have a direct effect with Quinte Home Builders. So I had some conversations with local builders. There's 134 members in the Quinte Home Builders. 36 are builders. The rest are partnership. So I asked about how can this work if this was to be sent and passed today with the province that goes to Toronto. The challenge is that part of the membership for the home builders or construction committee or sector, banks, legal firms, professional services, real estate, suppliers, they're all a part of the home builders. So that number looks 134, but when you really do look at it, 36 are actually builders. So I talked to some of the builders, the relationship with the city of Belleville. They talked about the departments, how proactive. Belleville apparently is the model now, according to Quinte Home Builders, with meetings with planning, finance, development team. They really feel like there's an investment from the city of Belleville. You're the model, I was told. There's quarterly meetings. And I would suggest possibly to Mr. Carr, who does a hell of a job chairing the planning committee, that maybe there's room for engagement there at these quarterly meetings with the home builders. The home builders sector in our community, all different types of housing options, multi-residence, townhouses, apartments, we want them to be affordable. Mr. Carr is bang on. He's not telling us anything new that people can't afford. Maybe it's time, too, that the wage for people goes up so they can afford to live. We just heard tonight, food insecurity. These are working families in our community. So the wages have to go up. Government fees on buildings has to be reduced. We know the work of the building community. Minor sports. They helped out the Belleville Police Service with the canine unit in Bax, named after a developer. We see Hospice Quinte, the Stan Klemensic Center. Stan Klemensic, longtime builder in this area. The Morris Rowland Center of Hope. I want to work with the home builders and not put up, some fences or challenges to make it work with them. I understand where Mr. Carr is coming from, but I'm hoping that maybe that conversation we attend or open that invitation to have the builders come with us and see how we can do that breakdown of making homes more cost effective so people can put a roof over their heads, raise their family with some disposable income, whether it's an apartment or a new home. Mr. Carr is bang on. People can't afford $800,000, $900,000 homes in our city. There's lots on the market sitting there, and they have been there for a long time. So these quarterly meetings, if we could have those conversations, they're already doing it with our staff. and they're really enjoying working together. So maybe that's something. I can't support this the way it's written, but there's some merit to some of it.
Okay, any other, Councillor Carr, the floor is yours.
Thank you, Mayor Ellison. One thing I've learned in this place is you just keep trying. Yeah, this is unique. This is different. I've spent a lot of time researching. I've listened to academics talk about housing. I've listened to special interest groups, and like I said, I went to virtually the Residential Construction Council of Ontario Housing Summit. The municipality in that summit just 2 weeks ago was the whipping post yet again about the fact that we're not doing enough to reduce the cost of housing. And we don't build houses. As I said before, the province is holding municipals accountable. They created strong mayors, which is essentially an agent of the province to say, you better meet those criteria, and here's some money to help motivate you. The province has not implemented their housing affordability task force recommendations, as everybody knows. They've shelved most of it. And so here we sit. We sit around this table, we talk about affordability all the time, and we maybe put forward a few proposals of drips and drabs to try to make a difference, but we gotta think outside the box here. And the reality is like, particularly over COVID, cheap debt for too long allowed people, and particularly, and I'm gonna use it quote unquote investors, because I think true investors take your money and invest in the stocks and businesses and production and growth. And there's a reason why our GDP is low, is because we're not investing in businesses, we're not investing in things to build and manufacture and sell abroad. All of our GDP is tied up in real estate, which is passive, which does nothing. And that's why we have speculators that buy land for $29 million or sell it for $29 million on a zoning change. That all adds to the price of homes. There's one academic that speaks to the fact that we're ignoring the fact that the land cost is what is the contributing factor. If you take a piece of property at $250,000, you're already excluding people who can afford a mortgage. At $500,000, you cannot afford a mortgage for the average worker in Canada. That's astounding. And so what we've been doing up until this point has not been working. Yeah, we're asking for accountability to the private sector. We're talking about housing, which the country has identified as a right. This is bigger than a pair of pants, and it's bigger than a tin of coffee or some other trade secret. This is about putting people into homes and making it affordable to do so. There's a generation coming behind us that is not going to be able to afford a place to live. So as we don't challenge the status quo on this side, get ready for people to continue to fall off the housing spectrum. And I know I'm talking to people here who have some experience in understanding that, as we see 3,800 families sit on social housing wait lists with a 7 to 10 year waiting time, when we see our homelessness population continue to increase. Those things, those problems are going to continue if we allow the status quo. It's about housing first. So at the end of the day, this is about challenging the status quo, and the housing sector is going to come to us. Mark my words. They did in Quinte West. They'll do it here. They do it all across the province. They're going to say that your charges and your fees, municipality, are contributing to affordability, and we'd like you to reduce them. Without understanding the formula, are we going to take them at their word? I don't know. I have met with the Quinte home builders. I've always encouraged communication. We might think a little differently on how we do things. There was talk about those quarterly meetings. Those are with staff. As an elected official, I'm not going to insert myself into operational meetings. That would not be the place. I had communicated with Quinte home builders and probably will talk to them in the near future. But this is about doing things differently. So I'm going to just challenge the status quo until we get things right. Thank you.
Councillor Unright Miller?
No.
Councillor Kelly?
No.
Councillor Millette?
9.
Councillor Sue?
No, thank you.
Councillor Thompson?
No.
Councillor Brown?
Yes.
Councillor Carr?
Yes.
Mayor Ellis?
No.
The motion is lost.
Okay, announcements. Councillor Thompson?
One announcement. On Friday night, we have our lighting display will go on. The food vendors are arriving around 4:30. We have 5 food vendors. And then the activities, Andy Forgy will start at 5 o'clock, 5:30. 6 o'clock, the mayor and I will say a few words. At 6:15, Santa Claus will arrive. At 6:30, Andy Forgy will come back on. Whoops, that wasn't even on, was it? No.
But you're loud enough that everybody heard.
Good. Anyways, Mr. McDougall will be speaking at the announcements at 6 o'clock on why he contributes $10,000 every year to the Christmas light display to buy fixtures. But he's not the only one that gives big money. We have other ones that give $5,000, $1,000, and this year was our biggest year we've had for contributions, which is amazing, and we've had probably 10 to 15 new ones this year. So it's out in the public, and I want to, and during that night, the mayor will thank the sponsors. So come on out, 5:30 on Friday, and enjoy the Christmas light display.
Announcements, Councillor Enright Miller?
Thank you. I would like to proclaim November 17th as World Prematurity Day. Whereas 1 in 10 babies are born prematurely worldwide and therefore at risk of long-term complications. Some babies will spend months in the neonatal intensive care unit before going home. Families face challenges from the moment their baby is born in terms of expenses, protection measures, education, and other related accommodations. Whereas the Canadian Premature Babies Foundation is a charitable organization aimed to raise public awareness about prematurity and provide support and education for families of premature babies. The Bridge Street Bridge, Fire Station 1 Monument, and the Belleville sign will be lit purple November 18th to the 24th in honor of this cause. Thank you.
Thank you. Councillor Sue?
Through your worship, thank you. I would like to proclaim November 18 to 25 as Talk to a Stranger Week. Whereas Talk to Stranger Week is a campaign intended to educate, empower, and canalize Canadians about the many benefits of talking to strangers. For decades, we have told Canadians and people around the world not to talk to strangers, when the research suggests that it may be a valuable way to increase happiness, feel a greater sense of belonging, build trust, and create safer communities. Whereas GenWell is a Canadian-led global human connection movement which seeks to highlight the need for all Canadians to recognize the importance of a human connection for their health, happiness, longevity, and the betterment of a society for all. Thank you.
Thank you. Councillor Brown?
Thank you, Your Worship. I just wanted to extend a thanks to all of the Ward 2 residents for attending the Thurlow Town Hall last week. We were able to address the capital budget and what we would be going into deliberations with. It was also a great opportunity to talk about the asset management plan and the 10-year plan in terms of the very forward thinking that we're doing. It did generate a fair number of questions. We also did talked about traffic calming. It was a new experience for many of our residents living in that area. I would again say that the response was more positive than negative. I think that generally I would say it was like probably a 90-10% kind of thing, but it was interesting to hear the people who are living with it every day. And they were very appreciative of something was being done. And then we had a bit of a Q&A. And so that's always a popular part of the agenda. We had, as I say, a full house once again, and something that certainly was encouraged that we continue to do that. So my thanks to my colleague, Councillor Carr, and to the residents for continuing to support the dialogue as it comes to matters around the council table. Thank you.
Thank you. Councillor Millet?
Thank you, Your Worship. I would like to proclaim November 12th to the 18th as Slow Down and Move Over Canada Week. This week is an effort to recognize the families of first responders who have been struck roadside and require financial, emotional, and mental health support, making memorials by the highway where they have been struck. It is important to be aware of and abide by the slow down and move over laws in our country designed to protect our first responders. That includes police, fire, ambulance, and tow truck drivers. Our first responders have families to go home to and hoping everyone goes home safe. The Bridge Street Bridge, Fire Station Number 1, Monument, and Belleville sign will be lit red, white, black, and yellow November 11 to 17 in honor of this cause.
Motion to adjourn. Councillor Kelly.
Thank you. Through you, Mayor, a couple of announcements tonight. Recently, I was at the special Diwali celebration at 151 Cloverleaf Drive in Belleville. That's up around Millennium Parkway and around there. The Sikh community invited me. It was an afternoon of food, prayer, reflection, triumph over good, over evil. And I want to thank Mr. Balwinder Randaha and Nakar Danbar and everybody I met at the Gurdwara. And on Friday, just over a week ago, for their Diwali festival, you know where the temple is, at 151 Cloverleaf. They had 5,000 people go through the door that day. Not over the weekend, on Friday. 5,000 people. Pretty special, and I was blessed to be invited. Also, too, this past Saturday, it was the Interfaith Summit in Belleville. Justice and Peace was the Islamic Society of Belleville hosted this interfaith summit in the afternoon, and it was educational, lots of good conversation and a chance to learn. Different speakers from the United Church of Belleville, Presbyterian, Christ Church, Seventh-day Adventist Church, and a Jewish community was represented. So bringing all these different communities together was really cool. So I want to thank Shahid Mohammed for putting that together today. And it's programs like this, bringing people together in all walks of life, all social backgrounds, and religious faith backgrounds. So pretty special, two really nice events. And this is all part of the equity, diversity, inclusion. We walk the talk in this city. We want our community to be diverse. Two examples that I've shared tonight. Thank you.
Thank you. Okay, I'll end. I've just got a couple of announcements here. Councillor Millet and I just returned from Lahr, Germany, our twin sister city, which we were celebrating not only the twinning of the 50 years relationship, about the closing of the airbase of Lahr 30 years ago. And I wanted to announce tonight that they will be Coming, our sister city will be sending a group of visitors in August. We will be looking for billets. So that will be announced very shortly out of my office. And my second announcement would be to thank some staff and thank all of you here tonight, actually. Without you, we would be a ship with no sails on it. But I just wanted to mention a couple staff, and one is Joe Reed and Brad Wilson. Both of them were in great help and support of our Veterans Crosswalk. And to watch that go up and see it go up about 10 o'clock at night. And I just want to comment that Brad Wilson, one of our supervisors, was there. And I spoke with him and I said, what time are you off tonight? He says, I'm not working. I just came to volunteer to watch this go up. So that's how good a staff we have at all our departments. And I know with the directors here tonight that with your leadership, our staff is great, and we are impressed with all you do. With that, I'd like to also thank Kim Taylor of Taylor Signs that helped with the silhouette of the soldier. That soldier now will be in storage, and we'll be renting it out to other communities next year, and hopefully it can be purchased by Quinte West at a discounted rate. But having said that, I need a confirmatory bylaw, a bylaw 2024-190, a bylaw to confirm the proceedings of council at this meeting held November 13th, 24, be read a first, second, and third time, finally passed this 13th day of November 2024. Moved by Councillor Enright Miller, seconded by Councillor Millette. All in favor, carried. Motion to adjourn, Councillor Sue, seconded by Councillor Millette. All in favor, carried. Thank you, everyone.